Hello future doctors, how are you all? Welcome back to MedSteps ECG series. So in our previous lecture day 1, we learned what is ECG and how we have to place leads. So today we are going to learn one of the most important ECG components, that is the P wave. So many ECG diagnosis begins with actually this P wave. So if you understand the P wave properly, you will be able to recognize atrial enlargement, arrhythmias, and many cardiac disorders. So without time waste, let's begin from the absolute basics. So what is P wave? The P wave represents atrial depolarization. So here we can see P wave, atrial. This P wave represents atrial depolarization. Now, what is depolarization? Before a muscle contracts, it must receive an electrical signal. So this electrical activation is called depolarization. So this depolarization occurs first, contraction occurs afterward. So first depolarization occurs first, then after we can see contraction occurs afterward. So therefore electrical activity we call that is depolarization, that mechanical activity we call that is contraction. Okay, so this is the things. So electrical activity means the current passing, that part we call depolarization, and once because of that current, if heart is pumping, that thing we called mechanical activity or contraction. So for example, in simple manner I will try to explain. Like imagine you are switching on a fan. Electricity reaches the fan first, then the blades will rotate. Similarly, depolarization occurs first, then contraction occurs afterward. So where does the P wave begin? So you can see here in this image how the P wave is formed. So if you are seeing means here the electrical impulse starts at SA node. That means this is the main natural pacemaker. The SA node will the electrical activity first impulse starts in SA node, like sinoatrial node. The SA node is called natural pacemaker of the heart, and it generates impulses at like 60 to 100 beats per minute. The impulse then spreads across both atria. The spread of electricity through the atria creates the P wave. So you can see here, we have one electrical impulse pathway. First one SA node, then after it the sequence will be like right atrium, then after left atrium, then after P wave appears on ECG, then AV node, then after its Purkinje fibers we can see, then after at last the electrical activity appears on ECG, then it will form P wave. Okay, so this is like pathway. First one SA node, right atrium, left atrium, then after AV node, then after Purkinje bundle of his and Purkinje system. Okay, so these are the things. Next you can see here, this is normal P wave characteristics. So for exam point of view, or if you are trying to do ECG interpretation, always remember the duration, the P wave duration less than 0.12 seconds means less than 3 small boxes. Or if you are seeing height, that is less than 2.5 mm and less than 2.5 small boxes. If you are seeing shape, it must be like smooth, rounded and upright. So same to same like this type of like dome shape. Okay, rounded you will get. So where should P wave be positive? So normally positive in lead 1 and lead 2 and AVF V3 to V6. So normally negative we can see in AVR. Okay, where can it be negative means it's normal negative in AVR. This is completely normal. So why is the P wave is important? What's the main importance behind this thing? So whenever you look at an ECG, ask, is there a P wave? Is it normal? Is every P wave followed by a QRS complex? These three questions, it will help to diagnose many arrhythmias. So in sinus rhythm, and in sinus rhythm and P waves, a normal rhythm is called sinus rhythm. Okay, in sinus rhythm we have one criteria. Sinus rhythm. Okay, this sinus rhythm have one criteria, that is heart rate will be like 60 to 100 beats per minute, and it must be like regular rhythm. Along with that P wave before every QRS, every P wave followed by QRS, a normal P wave morphology. Okay, so these are the things very important. So next you can see here, so why it's important, because the P wave denotes atrial depolarization, and there should be a P wave for every QRS in normal sinus rhythm. The P wave helps in diagnosis for helping like atrial enlargement and arrhythmias, and always look for P wave before interpreting the rest of ECG. Okay, so we already discussed about this normal sinus rhythm. The normal sinus rhythm, you can see same distance in both R. Okay, so the boxes will be like same, so that thing we call normal sinus rhythm. We already discussed about that criteria. Okay, so next step, then after if you are seeing here, that is like for a clinical example, you can see this image. In this image you can see here the every P wave, then after QRS, then after this is T. Okay, so here what happen, so in while doing interpretation, you have to check the P, QRS and T, the regular pattern. If you have regular pattern, then that is normal sinus rhythm. So abnormal P waves. Now let's move to clinical medicine. So if you are seeing here, that is right atrial enlargement. Okay, how you can tell that is right atrial enlargement means, you have to see in lead 2, because the right atrium becomes enlarged. So here, for example, if any patient have like chronic obstructive pulmonary disease COPD, or pulmonary hypertension, or tricuspid valve disease, or congenital heart disease, we can see in ECG, we can say like tall peaked. In ECG we can see tall peaked P waves greater than 2.5 mm in lead 2. Okay, so especially in lead 2 we can see the height will be like 2.5 mm, and this is called pulmonale. P pulmonale means the pulmonary disease like right atrial enlargement. We can see tall P waves. Tall P waves we can see along. If you are seeing tall P wave, we have to suspect that right atrial enlargement. Okay, next one, left. We have an exam trick for right pulmonary P wave. Tall P wave, think right atrial enlargement or P pulmonale. Okay, next we can see here, that is left atrial enlargement. It occurs in mostly like mitral stenosis, mitral regurgitation, long-standing hypertension and heart failure. So in ECG findings we can see broad P wave. This is P wave. In this P wave you can see broad like M type, or you can see like one is heavy slope, another one small slope, like this you can see. So this is broad P wave, notched P wave, or you can see M-shaped appearance, especially in lead 2. So if you are suspecting anything about atrial enlargement, in right atrium you can see tall peaked P waves. In left atrial enlargement you can see M-shaped P wave in lead 2. Okay, this is called P Mitrale, means the mitral valve diseases or left atrial enlargement are broad bifid P wave and P mitral. Okay, so for exam trick you can think left atrial enlargement means P mitral. Mitral means M-shaped. So next, the P wave and atrial fibrillation, one of the most important ECG diagnosis in atrial fibrillation, there are like no distant P waves. Okay, and instead we can see irregular fibrillatory waves or regular rhythm. Irregular or regular rhythm we can see. You can see here, this is the distance. You can, if you are saying, means the patient will get problem with the distance. So how we can calculate that heart rate, means if patient getting that type of things, we have to check every, like we have to count total strip R waves by 6. Okay, if you are counting, means you will get your heart rate. So next, in atrial fibrillation, the high yield point, if you are saying, means no P wave, and you can see irregular rhythm, and it will cause it, that means that is atrial fibrillation. So no identified P wave and irregular rhythm and fibrillatory F waves present. So next we can see with P wave we can find out, we can diagnose atrial flutter. The atrial flutter you can see like this, that is sawtooth pattern we can see here. So in this atrial flutter, the flutter produces sawtooth pattern instead of normal P waves, usually best seen in lead 2, lead 2, 3 and AVF. So next, in clinical correlation, the atrial flutter we can see sawtooth, means you can see here, that is, this is sawtooth flutter waves you can see are not normal P wave. So you can't see any P wave here. Okay, so the AV conduction, maybe you can see like 2:1, 3:1 or 4:1. Regularly the atrial heart rate will be like usually 250 to 350 beats per minute. Okay, next we can see here that there is like P wave will help to diagnose heart blocks. How? The P wave presents, normally the P wave always work with QRS complex, but here what will happen, if conduction through the AV node is delayed or blocked, then we can see heart block will develop, and therefore always observe this every P wave have a QRS. But if not, think patient have atrioventricular block. Okay, so always the this P wave or some P waves are not conducted, so it will causes AV nodal block. Next we have to always check PP and RR relationship. But here if you are not saying anything, then you have to suspect, if the P wave is not following to QRS, then you have to think AV block. Okay, so this is the things. Now systemic approach. Now systematic ECG approach, if you are saying, means first whenever you are reading ECG or interpreting ECG, first we have to focus on, is a P wave is present or not, is the P wave is normal or not, is every P wave followed by QRS or not, is there one P wave for every QRS or not, like that we have to check ourselves. These questions alone can diagnose many arrhythmias, so that's why it's very important. If you are saying, if you are trying to write, if you are preparing for any FMGE, NEET PG or clinical rotation and exams, then these are the main important points, high yield points I'm going to tell now. That is, P wave means it will cause atrial depolarization. Tall P wave means we have to think that is P pulmonale, means right atrial enlargement. Next, broad notched P wave means like M type P wave means, if you are saying, means that is pulmonary, like P mitrale means left atrial enlargement. So if you are seeing any no P waves, irregular waves formation, if you are suspecting patient have atrial fibrillation, so no P waves, then that is atrial fibrillation. Sawtooth waves, if you are seeing like heart rate 250 by 300 means, 250 to 300 means, then we have to suspect patient have atrial flutter. Next, P waves before every QRS, that is sinus rhythm. So why does the P wave represent? So if P wave is not followed by QRS, then we have to suspect that is heart block. Okay, so next you can see here, that is in rapid, I will ask some questions. So why does the, if you can do comment based on these questions. Okay, so if you listen everything properly, you can answer in comment section. What does the P wave represent and where does it originate? Tail peaked P waves and a broad notched P wave, and no visible P wave means what it indicates, and sawtooth pattern means what it indicates. So I will ask one clinical question before completing our video. So a 65 years old patient has an ECG showing no identifiable P wave and an irregular rhythm. Irregular rhythm. So most common diagnosis you can comment on. You can comment in. You can comment that answer. So I will give reply. So today we learned everything about the P wave from basic physiology to clinical ECG interpretation. So in this lecture we will discuss the PR interval, one of the most important concepts for understanding heart blocks and AV nodal conduction. So we will see in our next day 3 med steps, so ECG series. So till the time I'm signing off. Take care. Bye bye.